Good evening, everyone, and thank you all for sitting so patiently. So my name is Murtada, co-founder at Written Medicine, and I'm going to tell you a little story.
I'm sorry.
So one day while my co-founder Ghalib was working in his shop, Mrs. Begum walked into the pharmacy, and she was recently diagnosed with high blood pressure. When he tried to explain her dosage instructions, it started to get a little bit messy, mostly because Mrs. Begum just didn't speak English that well. She needed to know whether or not to take the tablets with food, whether there were any interactions with alcohol, how many tablets to take, and of course, how often to take them. This kind of frustration wasn't new to Ghalib. He felt it pretty much every day while he was working there because he didn't speak the local language, and of course, Mrs. Begum wasn't that good at English. And that was the spark that really kindled Written Medicine. As you might imagine, translating for medicines just isn't that easy. You can't use tools like Google Translate just because they're too risky in this kind of environment. And that's why we decided to innovate. So I've been practicing as a pharmacist since 2007, and I'm the strategic director at Written Medicine. Ghalib has been working as a pharmacy dispensing tech since, I think, before the 2000s, so that's ages ago. He single-handedly grew our network from a couple of contacts to a huge list of people with influence in the NHS and pharmacy. Tucker, our software developer, has been coding for more than 7 years, and he's an expert when it comes to PHP, jQuery, Java, so on and so on. So we put our heads together, and we came up with a way for a small piece of software to produce translations that were 100% accurate 100% of the time. And the result is a simple, elegant solution, a label with 2 languages, English and the language of the patient's choice. So we took this version of the software and we trialed it in 25 pharmacies in and off the Edgware Road, which is the highest concentration of Arabic speakers in the country. To get this up and running was so much more complicated than we thought it would be. We had to liaise with a whole bunch of NHS organizations, including those 2 listed, as well as a Department of Health offshoot, and of course, pharmacy insurance providers, not to mention the pharmacists themselves. So now that Mrs. Begum and the 5 million other speakers of English as a second language in the UK have the potential to understand their medication prescriptions, why should you care? Well, £99 million is wasted each year on this group alone in medication waste. Another 40 million is wasted when these patients get sicker as a result of not taking their medicines properly. Another £37 million is lost on hospital admissions because of drug side effects, which are just much more common when you take too much of your medicines. This amounts to a staggering £176 million. Now imagine how many nurses you could employ with that. So what's happening next? Well, I'm happy to tell you that today, finally, a couple of hours ago, we got the email confirming our partnership with City and Hackney CCG, which is the NHS body on the ground which decides which services are distributed in the area, to offer the service to 30 pharmacies in 11 different languages for a whole year. So the year Thank you. The year 2015 is going to be very exciting for us. So I want to take you back to Mrs. Begum. I mean, it's all well and good that she can understand her medication, but is that really enough? I mean, imagine if you could use this kind of technology to mediate the consultation between her and her GP. Or if you could give her the ability to look up something on her phone reliably, like we do every day and we take it for granted. That's our entire ethos. We want to empower patients to take better care of themselves and make better use of their medicines so they can all live longer, healthier lives. So, how can you help us? If you know a commissioner in the NHS, then please come and talk to us. I know that they're never around, they're impossible to find. If you know a pharmacist in retail or in hospital who could make use of our software, then please put us in touch. Alternatively, if you know a patient who could make use of the service, then please take our business card to pass on to their pharmacist, and we can take it from there. Thank you all for listening. And I wanted to close just by saying, on behalf of Written Medicine and the rest of the cohort, thank you to Team BGV. You're awesome.